Hello everyone, I'm Angeline Kirbai, Assistant Professor, Department of Biotechnology, St. Joseph's College of Arts and Science for Women, Hosur. Today we are going to see about sexually transmitted disease. Sexually transmitted infections include those infections which are predominantly transmitted through sexual contact from an infected partner. Although the transmission of the infection is mostly due to the sexual contact, other mode of transmission include placental, blood transfusion or injector needles. STDs include syphilis, herpes, HIV or AIDS, chlamydia, gonorrhea, trichomonas vaginalis. First one is syphilis. It is caused by the spirochete Treponema pallidum. Syphilitic lesions of the genital tract is occurred by direct contact with another person who has open primary and secondary syphilitic lesions. Transmission occurs through the abraded skin or mucosal surface. There are four stages to the progression of the infection. First one is primary stage, occurring on average 21 days after exposure, where a single painless, firm, non-itchy ulcer or canker appear. Second stage occurs between 4 to 10 weeks after exposure with the appearance of non-itchy diffuse rash with fever and sore throat evident. Latent phase. The individual is generally asymptomatic but still contagious to others. Tertiary phase can occur between 3 to 15 years after the initial exposure. If the person doesn't seek the treatment, they will exhibit neurological symptoms such as general sepsis and seizures, as well as cardiac symptoms including aneurysms. Diagnosis and treatment. The serological test VD-oral. The specific tests include Treponema pallidum, heme agglutination test. The treatment. Early syphilis. That is primary, secondary and early latent syphilis less than 1 year duration. Benzathine penicillin G 2.4 million unit is given intramuscularly in a single dose, half to each buttocks. Latent syphilis. Benzathine penicillin G 2.4 million units is given intramuscularly weekly for 3 weeks. Alternative regimens doxycycline 100 mg orally twice daily or tetracycline 500 mg orally 4 times a week for 4 weeks. The next one is herpes simplex virus type 1 and 2. Type 1. Herpes is an infection caused by herpes simplex virus. It causes sores on genitals and mouth. The incubation period is 2 to 14 days. Sores around vulva, vagina, cervix, anus, pernis, scrotum, buttocks, inner thighs, lips, mouth, throat and rarely eyes. The causative organism is herpes simplex virus type 1 and 2. Type 2. It is usually transmitted sexually by an infected partner but may possibly be transmitted by orogenital contact. Herpes simplex is spread from skin to skin contact with the infected areas. Herpes can be spread to other parts of the body by touching sore and eyes or other parts of the body. Diagnosis and treatment. Diagnosis. Virus tissue culture and isolation is a confirmatory test, and detection of virus antigen by ELISA or immunofluorescent method. PCR test is identify the HSV DNA is the rapid, specific and most accurate test. Treatment. The specific treatment is yet to be explored. Rest and analgesics are helpful. Acyclovir and valacyclovir. These are all the some antibiotics for the treatment. The next one is HIV. The HIV or AIDS human immunodeficiency virus causes an incurable infection that leads ultimately to a terminal disease called acquired immunodeficiency syndrome. The main mode of transmission of HIV are sexual contact, transplacental, exposure to infected blood or tissue fluids through breast milk. Clinical presentations. Acute infection syndrome is characterized by fever, skin rash, arthralgia, lymphadenopathy and diarrhea. It lasts less than 2 to 3 weeks and resolves spontaneously. After the initial exposure, the person remains asymptomatic for many years. The median time to develop AIDS is approximately 7 to 10 years. Increase the immunodeficiency, they become susceptible to secondary infections by opportunistic organisms. Treatment, preventive and definitive. Preventive measures include safe sex, practice with health education, barrier methods are effective to reduce transmission 80%. Use of blunt tipped needles to avoid needle stick injury during surgery. HIV negative blood transfusions. Post exposure prophylaxis with zidovudine and lamivudine is advisable. To maintain protocols for correct handling of all body fluids. Definitive HIV treatment protocols change frequently. Antiretroviral therapy, that is nucleoside reverse transcriptase inhibitors, zidovudine, zalcitabine, lamivudine, stavudine. The next one is non-nucleoside reverse transcriptase inhibitors, dilavirdine, navirapine, efavirenz protease inhibitors, and indinavir, squinavir, ritonavir. Chlamydia. It is most commonly diagnosed STI, especially in under 25 years olds, and is caused by the bacterium Chlamydia trachomatis. Between 17 to 80% of women affected by chlamydia are asymptomatic. The organisms affect the columnar and transitional epithelium of the genitourinary tract. The infection is mostly localized in the urethra, Bartholin gland, and cervix. Incubation period is 6 to 14 days. Clinical features. It is non-specific and asymptomatic in most cases. Dysuria, dyspareunia, postcoital bleeding and intermenstruation bleeding, lower abdominal pain, cervical discharge, conjunctivitis, eye infections, and sore throats following anal or oral sexual practices. If left untreated, chlamydial infection can cause pelvic inflammation disease, which increases fertility and the risk of miscarriage and ectopic pregnancy. Diagnosis and treatment. Diagnosis. Methods of testing include urine test, low vaginal swab, and cervical swab. Chlamydia antigen can be detected by ELISA techniques. Treatment of chlamydia. Azithromycin, doxycycline, ofloxacin, erythromycin are the antibiotics given for the chlamydia. The sexual partner should also be treated with the same drug regimen. Gonorrhea. Such symptoms include painful mixed urination, yellow and blood-stained vaginal discharge, and postcoital bleeding. If untreated in women, it causes PID, giving rise to abdominal cramps, fever, and intermenstruation bleeding with an increased risk of